chances are you or someone you really care about is dealing with a chronic health condition. It's this massive and often pretty invisible challenge that touches almost everyone on the planet. But what if we're standing on the edge of a whole new era in how we manage it? Let's dive into the blueprint that's helping turn this burden into a new kind of hope for chronic care.
To really get a sense of the scale here, you just need to know one number: 74%. That's the percentage of all global deaths caused by chronic, non-communicable diseases every single year. We're talking about 41 million people. So this isn't some small niche issue. It's pretty much the defining health challenge of our time.
So, first things first, let's really define this crisis. What exactly are we up against? And more importantly, what does it actually feel like for the people living through it?
Okay, so what exactly is a chronic condition? Well, it's not like catching a cold that you get over in a week. We're talking about something long-lasting. Think heart disease, diabetes, or asthma that requires a really fundamental shift in how a person lives their life and, just as importantly, how the healthcare system supports them. And look, this isn't some problem happening way over on the other side of the world. Let's bring it home. Take a country like Australia. Nearly half the population, 47%, is living with at least one chronic condition. It's a shared experience that's touching almost every family, every community.
But honestly, this goes so far beyond just numbers on a chart. For an individual, getting that diagnosis can completely change their world. It can affect their independence, their mental health, their finances, their entire quality of life. It becomes a continuous, daily challenge, not just for them, but for their families too.
So when you're faced with a challenge this massive, where do you even begin? Well, the answer isn't in a single cure, but in a system-wide response that's built on one core idea: empowerment.
This whole concept is called health promotion, and it's not about just telling people what they should or shouldn't do. No way. It's a huge shift towards empowerment. It's about giving people the tools and the control they need to improve their own health.
So how do you actually create that empowerment? Well, systems have three main tools in their toolbox. First, there's education, right? Giving people the knowledge they need. Then there's social marketing, which helps shape healthier community attitudes. And finally, there's legislation, creating policies that actually make the healthy choice the easy choice. Okay, so we've looked at the big picture philosophy. Now let's zoom right in on a specific framework that has been a total game changer: the chronic care model. This is it, the chronic care model, or the CCM. Think of it as the master blueprint for all of this. It was developed to bridge that huge gap between what we know works for chronic care and what actually happens in a typical doctor's visit. The core idea is simple but revolutionary. The patient should be the one leading their own health journey, and the entire system needs to be redesigned to support them in doing that. Now, the CCM is built on 6 interconnected pillars. They all have to work together. It starts with the big picture: support from the wider health system and the community. That foundation then allows for better delivery design and information systems, and that, in turn, gives doctors the decision support they need and gives patients the tools for self-management. See? Every single piece has to work in harmony for it to be effective.
All right, let's pivot to what is, without a doubt, the most important part of this whole story: the person who is actually living with the condition. This new approach puts them right where they belong, firmly in the driver's seat.
This focus on the patient didn't just happen overnight. It was a journey. It really started back in the 70s with the rise of patient education. That laid the groundwork for the more systematic chronic care model in the 90s. And today, that has evolved into what we call a truly patient-centered approach, where care is holistic and tailored completely to the individual.
But here's the thing. Just giving someone a pamphlet or a bunch of facts isn't enough. The real psychological engine behind all of this is a concept called self-efficacy. In simple terms, it's a person's belief in their own ability to manage their health. Without that confidence, all the education in the world just won't translate into action. And what's really cool is there isn't just one single way to build that belief. 2 major approaches show this really well. You've got the Lurid model, which is led by peers and based in the community, and then you have the Flinders model, which is led by a clinician and is highly personalized. They're different, but they're both incredibly effective paths to the exact same goal: a confident, empowered patient. Okay, so we have the systems, we have the models, we have the empowered patient. But there's one more crucial piece to this puzzle that makes it all work, and that's the human connection. So you have to ask yourself, right? With all of these different moving parts, who's the guide? Who is that vital human link that helps a patient navigate this sometimes complicated new landscape and truly take charge of their own health? And the answer, in so many cases, is the nurse. They are so much more than a caregiver. They are the educator, the coach, the coordinator, and the advocate. They're the ones on the ground to activate this blueprint and really help patients succeed.
And that brings us to our final thought. We've gone on this journey from seeing chronic disease as just a burden to having a real blueprint for better care. We know absolutely that the patient has to be the leader. So let me leave you with this question. What do you think is the single most important thing the entire healthcare system can do to truly support that leadership?